All right, we are going to go ahead and get started. Good afternoon, everyone. Thank you for joining us. My name is Carol Gieske. I'm the President and CEO of Elgin Area Chamber of Commerce, and we're just thrilled that you could join us today for our second meeting for a vaccination update for businesses. It's been really terrific working with my colleagues up and down the Fox River Valley. So thanks to those folks who are with us. And if your screen is showing your face, do wave. Geneva Chamber of Commerce, St. Charles, Huntley, Bartlett, Hampshire, Elgin, Algonquin Lake in the Hills, Cary Grove, and the Northern Kane County Chambers. We've all come together so we could offer this program to you today. We are recording the program for those who aren't able to join the meeting, and it will be on each of our chamber websites. Please, after the meeting, if you're interested, go to the chamber and you will find that later this afternoon available to you. Before I introduce today's presenter, just a few notes. Please do mute yourself. We're going to have Mike's presentations for a while before we go into Q&As, so it works so much better if everyone's just able to mute themselves and listen to the conversation. We will have the chat box available, so you are welcome to place your question in chat. And as we open it up towards the end of the meeting with Michael, we'll be able to address some of those questions. It is now my pleasure to introduce to you Michael Isaacson, who is the Assistant Director of Community Health at the Kane County Health Department. This is one popular guy. I guess only Dr. Fauci would have one up on you, Michael. What do you think?
I don't know about that. I think if we had more vaccine to provide to people, we'd be a lot more popular. So thank you. In all seriousness, thank you. And thank you to all of the chambers in Kane County who've been excellent to work with as we try to get information out. We want this to be useful information, and we want it to be something that you can act on to take care of your team. So I'm just going to go over a few slides here, and then I want to make sure that we leave plenty of time for questions and answers to hear people's specific concerns. So starting off, I always like to provide at least a brief update of where we are with COVID in our community. So there's three measures I typically share that the state looks at from a regional perspective. So number one, the test positivity. So that is, out of every 100 tests that we administer for COVID, how many are coming back as positive that somebody has COVID. You can see here over the last 30 days that this line continues to go down. Looks like we had a slight increase yesterday, or not yesterday, but the 13th. There's a couple day delay on this. With the data that was reported yesterday, we had a slight increase. But we're under 5%, which is excellent. A little while ago, a couple months ago, we were up over 16, 17, 18% in Kane County. So now to be under 5%, that's outstanding. We are seeing a slight decrease in testing around the state and around Kane County because of the excitement and the shifting of resources for vaccine. This is something we want to be mindful of, and we still are encouraging people to actively be testing. So if you have an opportunity in your workplace where you can do testing, we encourage that. The second measure is looking at hospital bed availability. This one's pretty straightforward. We try to maintain at least 20% of our ICU beds open so that we can meet any surges that we may be seeing. You can see from the chart here that over the last month, we've looked really good on that measure as well. The next and final regional metric that we look at, or that the state looks at, is hospitalizations for COVID-like illness. You can see again over the past month, we've seen a nice steady decline here. So that's good news. Fewer people testing positive, fewer people being hospitalized. We're moving in a positive direction with this. So this is very exciting. And then just for perspective, I've started adding this next slide. So here's the last 30 days. But if I go out and show from the summer, you can see where we've been. And I think that's important to point out. So here's where we are now, where we're dropping down to in Kane and DuPage County, we're closing in on only about 200 people in the hospitals. But after the spike that started really around the end of October, hospitalizations were up 3.5 times what they are now. And then we've seen this decrease. So We've been through a really tough spike, and we hope that if people continue to take protective measures and people are able to get the vaccine, that we're continuing to see these numbers moving in a positive direction. The main thing that we're concerned about, though, ultimately is how many people are losing their lives to COVID. So this chart shows from the summer to now. Again, just pointing out that after the spike right here would be in October, would be when the cases and test positivity really started to go up. And then there's a delay before we start to see the increase in deaths. So unfortunately, we had a period there where we were seeing 3 and 4 and 5 deaths per day in Kane County. This particular chart is specific to Kane County. The previous ones were for Kane and DuPage together, but this chart is just looking at Kane County. Again, we're moving in the right direction, but still, as of the last week that was reported here, this data is updated on a weekly basis. So you can see this was last updated on February 12th. But we're still losing 2 of our residents every day. So that's still too many. And I don't know if people do look at the press releases or the news every day. We're losing people in their 30s, their 40s, their 50s. So it's not just the population 65 and over, but we're actually we're losing younger people as well. So this is still very serious, and we need to remain diligent for several months yet. One thing that we've been trying to do a better job of is explaining the process for vaccine. So this is a new chart I just put together, and I'll be interested in people's feedback. But this is what we do on a weekly basis. So every Monday, we send a survey to the community providers that we're working with to provide vaccine. And we ask them how much vaccine they have on hand, because we don't want vaccine sitting in coolers or sitting in freezers. We want it getting into people's arms. We also ask them how many vaccinations they administered the previous week, just to double check that against our records. And then most importantly, we ask them what their projected needs are for the next week. So this is information that we use as part of our math to figure out exactly how we want to distribute vaccine on a weekly basis. So to be one of our providers, it's a 2-step process that people need to complete, or really a 3-step process. They need to be part of the state's vaccine registry, which we call iCare. They also need to be approved through the state and the CDC as a COVID provider. Those 2 things will get them on the state's list. And then we enter into the 3rd step is we enter into an MOU with them, just saying that they're going to follow the guidelines, et cetera. So anybody who's been through those 3 steps, they get on our local provider list, and we'll send them the survey. I'm spending a little more time on this because depending on the size of your organization, if you have somebody who's providing occupational health services on site, there is the potential that they could become an approved vendor that we may be able to just provide vaccine directly to them. Or there's lots of other options, which I'll talk about in a moment. So back to my timeline here. On Monday, we query our partners and say, okay, how much vaccine do you need next week? Every Wednesday, we get a notification from the state where they tell us how much vaccine they're going to make available to us for first doses. So the 2 vaccines that we're using now, Moderna and Pfizer, are both 2-dose vaccines. The second dose we manage separately. So anybody who gets a first dose, the state automatically sends us vaccine for the second dose. So on Wednesday, they tell us how much vaccine we're going to get for the following week, or how much we're able to request. Last week, what we were told that we would get this week is 1,000, little less than 1,500 doses for new first doses. So that means out of all the people that we need to vaccinate in Kane County, 530,000 residents, out of all the people in the 1A and 1B priority groups, we're only getting 1,500 doses this week to vaccinate new people. So there's a lot of consternation, and people are upset that the planning, they don't feel the planning's been done correctly, or why aren't we doing more clinics in different places? we have a lot of plans in place that once we get the vaccine, we're going to be able to push out and expand. Everything we have is scalable, including working with our providers, our employers rather, to do more on-site work. So if we start getting more vaccine, we're going to be able to work with you more closely and potentially set up joint clinics or set up clinics just for different employers here so that we can get your employees taken care of in a timely manner. So on Wednesday, we find out. So today, sometime we should get a notice for how much vaccine we're going to get next week. We've been told that the 1,500 we're getting this week, it'll probably be something similar for next week, but that it should start picking up after that. So this state has told us that there's most of the vaccine going out these 2 weeks are going to be directed to second doses, so that it's going to be a much smaller number going to first doses. So we're still providing a lot of shots, but it's giving people second doses rather than adding new people to the list. So Monday, we ask our partners what they would like to see. Wednesday, we find out from the state what we can expect from them from the following week. And then on Thursday, our team takes the information from Monday and Wednesday, and we put in a formal request to the state based on what they've told us we can ask for. We always ask for additional vaccine. We almost never get the additional vaccine. Sometimes we don't even get the amount that they told us we would get. But that's kind of the process. I put the little orange circle or peach circle or whatever color that is down in the corner. More providers are getting direct shipments. And this is something that I've talked about all along that is going to be a complicating factor that adds to the complexity for people to try to find vaccines because it's not coming through the health department necessarily. It may be coming from the federal government, or it may be coming straight from the state, and we may not even know about these doses coming into our community. So I view this as a positive, and as an employer, I encourage you to be in communication with your local pharmacies, because there may be opportunities for you to set up on-site clinics where OSCO or CVS can come out and actually help vaccinate your employees. But it may not be something that we're aware of at the local level. And even we had a call with the state this afternoon. The state doesn't even have a list of all of the pharmacies that are getting direct shipments from the federal government. So the Fed sends it to the local pharmacies and doesn't tell the state. The state sends it to local pharmacies and doesn't tell us at the local level. We're trying to get that all clarified. We're trying to get more information because it just creates a lot of duplication as we work with some of the same locations, whether it's senior housing facilities or large employers. We're trying to get more clarity around that. But thus far, I think I still view it as a net positive because it means there are more doses of vaccine that are coming into our community. Just a couple quick words about the priority groups. So this is in the news quite a bit. I always like to point out just how large this group is. So even though we're calling it a priority group, we're on the phone and answering emails constantly, and I know many of our partner organizations are as well. For the population age 65 and over, that's over 75,000 residents in Kane County that are in this priority group just based on age. The older population there is on this list and is prioritized because that is who we have seen is at most risk for serious illness and death. So as you can imagine, there's a lot of people who are strongly advocating that we get this population their vaccine first, and that makes sense. The other groups on here, first responders, education, food and agriculture, manufacturing, corrections, inmates, postal workers, public transit, grocery stores, shelters, and adult daycare centers, those are all on this list because of the nature of the work that they do or where people are. They're at increased risk for getting COVID. So obviously all of these people on this list are advocating that their group should be served because of the increased risk, which that makes sense. So when people are talking about what's the best thing to do, there's no one answer for this, because if we serve, for example, people in manufacturing who are more likely, based on the nature of their work, more likely to be exposed to COVID, we could potentially, by protecting them, we could be reducing the total number of cases of COVID in our community. and that will stop later spread. So that is good, and that protects all of us, including our senior population. But when we talk about the seniors, ultimately preventing serious illness and death, that's the main thing we're trying to do. So again, there's strong arguments for all of these groups to be served. And as if this is not enough, and this is well over 100,000 people in Kane County. Again, we got 1,500 doses this week. And these are a 2-shot vaccine. So really, we've got a couple 100,000 shots we need to give for this group. This week, the governor has announced that they're expanding, or last week, I guess it was, that they're expanding the 1B category next week to include health conditions. Same thing for health conditions. It really breaks my heart to talk to people who have serious health issues that are not eligible to get a vaccine. I talk to people who are on lung transplant lists and have serious respiratory illnesses who have not been eligible to get a vaccine. Now there's talk of opening that up on the 24th, where we'd be able to provide more vaccine to those people. That's great, and that makes sense, but it doesn't change the supply side. So what we've done by expanding that is we have dramatically increased the demand, while supply has stayed stagnant and is actually a little lower even than it was a couple weeks ago. So that's problematic and is going to create more tension and more anxiety for people who are trying to get the shot. But I do anticipate this is going to continue to improve. So you may see on the news that some jurisdictions, I've seen Chicago, Cook County, Lake County, have said that they're not ready to expand the 1B category because they're still working on this current list. We have not come out with a formal statement like that in Kane County. I don't know that we will. But I do know that many of our providers that we work with, including the hospitals and the federally qualified healthcare centers, because those are people's medical homes, they know people's health status. So as they are prioritizing within their own patient pool, they're already able to take health status into account, as well as age. So I think at the end, over the next several months, we want everybody to be vaccinated. So this adds to the complexity right now, but at the end of the day, we need everybody to get the shots anyway. We're trying to be as transparent as we can with how we use vaccine here in the community. So this is something that we're going to start making more available to people. This just shows for the organizations that we're working with how many doses we've distributed to each group. So you can see there's our 5 hospitals, 3 of our federally qualified healthcare centers. Meyer, we've provided vaccine to. However, there are also other pharmacies in Kane County who also have vaccine that they've received from the state or the federal government. We worked with this Prism Health Lab to do some vaccinations at community sites. And then we're starting to add more family practices now. Hopefully, as more vaccine becomes available, we'll be able to add more practices. So to date, we have received and distributed just over 33,000 doses. I do want to note that this is only vaccine that's come to the health department, which we have then shipped to these places. They've either picked it up or we've delivered it to them. We're also able to request direct delivery that comes through the health department ordering process, but it's directly shipped to these organizations. Again, in terms of how some of the data is not quite clear, when we put in a request, and I'll just use Northwestern as an example because they're at the top of the list, if we request 1,000 doses to be shipped to Northwestern, as soon as we put in that request, we can no longer see it on our side of the computer system. So we're dependent on asking Northwestern if it ended up getting approved and if it ended up being delivered. And for most of these entities that are on this list, they're in multiple counties. So they're getting shipments all the time from multiple counties because they're either large hospital systems, our federally qualified healthcare systems bleed into other counties, and certainly our pharmacies are mostly, nationwide, if not at least regional. So that creates a little bit of uncertainty in terms of how much is going on. So for this particular chart, this is just the vaccine that we've received and provided to people, but there is more that's going out. So to date, we've received about 54,000 doses. We should be getting more this week. Of course, with the weather that we've been seeing across the country, there's dramatic delays everywhere. So we've been reminded multiple times that we can expect delays for what may show up this week. Again, we're only expecting about 1,500 doses for new people to get vaccinated. And then we're expecting about 6,700 doses for second doses. So there is still vaccine coming in, but that's already allocated to people who've already had their first dose. So it's positive, it's progress, but it's still not new people getting their first shot. I do encourage people to sign up for our weekly newsletter that goes out with information about the vaccine. Again, I'm fully aware that the information has been relatively limited so far, but as more vaccine becomes available, we'll be able to provide more actionable information. For our 1,500 doses, for example, there's only so much we can say to the 70,000 people who are signed up for this newsletter about where they can go to get the vaccine because it's so limited right now. Also encourage people to keep an eye on our website. We do have information not only about vaccine, but also COVID in general, including different toolkits and things that businesses can use. And then we are in ongoing discussions, specifically right now, really focused on senior housing and large employers, just trying to plan for the future. Just a note, though, as I said before, if as an employer, you can get CVS Pharmacy to come on site and vaccinate your employees, even without working through us, I view that as a great positive. So not to add to the confusion of saying, well, everybody should be calling every pharmacy and overloading them with phone calls. But if you can negotiate with somebody to get an on-site clinic set up, I think that's fantastic. I don't want to slow anybody down. But as time goes on, we will continue to add people that we're able to work with and provide vaccine directly to you. And we can either make appointments that are available just for large employers or all size employers really that are in the 1B category. But also if it's a larger employer and it's worthwhile, we can work to set up clinics actually on site. I leave this on here, although I've been saying lately it's a little bit embarrassing because this slide I think I first used maybe six or 7 weeks ago, saying, okay, vaccine supply and predictability should be increasing. Every week I still say I'm optimistic. We do have a new vaccine in the Johnson & Johnson vaccine, which is a 1-dose vaccine, which should be available soon. I am optimistic that this is going to get better on the supply side. So I leave this on here, but I also do note that this has been part of our messaging for a while and it has not come to fruition yet. We are continuing to increase the number of providers that we're working with. So those opportunities in the community to get vaccine are increasing. So that's a positive. And as I mentioned, the direct shipments to providers, either through the health department, through the state, or through the federal government, all of those are increasing. And in fact, the federally qualified healthcare centers will start to get direct shipments soon that won't come through the health department. So again, it'll add a layer of complexity, but hopefully it's more vaccine that's coming into our community. So just a quick snapshot of how we've been doing here in Kane County. This is a look on the left here, how many shots are administered daily. And then the orange line is looking at the 7-day rolling average. So this is as of yesterday. They just posted today's data on the website I just saw right before this meeting. So this is our daily average where we're right around 2,500 because over the holiday weekend, it was a little bit slower, but we were up to around 2,700. My goal is to get us up to 3,200, 3,500, 4,000 shots per day. The higher we can raise that number, the quicker it's going to be for us to be able to work through our population. So we are trending in the right direction, at least. We are still going to be administering shots. So even though I'm regretfully saying we're only getting 1,500 new doses, we still are providing a lot of vaccine in the form of second doses to people. So we will keep adding to that total. Another question we get quite a bit is just around age. So here is the information about who has received shots. So about 1/3 of the population that's received a shot is 65 or over. Then about 2/3 are younger. Part of this is looking at that 1A category, which included long-term care facilities. So that would tend older, but it also includes staff of long-term care facilities, and then all of the medical personnel in our community and working in healthcare, so which tends to be younger than 65 on average. This number will change as we move forward. We have administered about a quarter, 25% or so of our residents 65 and over have at least had their first shot. So we're starting to work through that population. Here's a link to the webpage where you can track all of this information. I think it is valuable to keep an eye on, and I think it's good for accountability to hold people accountable. There are numbers on there, which I didn't include in the presentation today, where you can see total percentage vaccinated, and you can compare from county to county. There are a few counties in the state that have significantly higher rates of their population who've been vaccinated. I really look at this as still being a major supply issue. If we had another 10,000 doses each week, we'd be able to provide, or 50,000 doses each week, we'd be able to provide way more shots to people. So we are in the Chicagoland area, because we tend to be larger populations, are on the lower end of things when we look at the whole state. But we're having conversations almost on a daily basis with the state and through our elected officials, trying to increase the amount of vaccine that's coming into our community. And then I always like to close with just the reminder that even with the vaccine coming out, and even though everyone is very fatigued, and I know we were talking about COVID fatigue early in the fall, we were all sick of this. So now here we are 6 months later, we're still sick of COVID. People are ready to get out, return to normal, open up businesses completely, see our loved ones. We still need to be careful for a while. So we still encourage people to wear face coverings and to keep social distancing as much as possible. So with that, I wanted to leave plenty of time for questions. So I'll
Michael,
stop
that's
there.
great. I would be glad to look at the chat box and share those questions with you. First one, is there a place where Kane County businesses can register for a vaccine? We have a number of employees interested. We are an essential business.
So we have done some surveying, and we've tried to be cautious with over promising to our local business community, just because of the slow rollout of the vaccine, that we didn't want to put a bunch of people on a list and have you wait and say, okay, I've been on your dang list for 6 weeks. How come nothing's happening? But I will send something out, Carol, and we can share it through everybody, and we can put people on a list as essential businesses. But also, like I said, I don't discourage your individual employees who may meet the criteria. If they can get it through their doctor or their pharmacist, I think that's great.
Can you hear me?
So want to make sure that that we're not asking people to wait when you could get the vaccine sooner through another method.
And I think one of the frustrations I've heard, Michael, is that seniors are having difficulty if they are not technologically savvy. Could you just insert the information that you shared yesterday about senior services associates being available to help those of us who have parents, loved ones who are elderly and not able to access a computer?
Absolutely. So tomorrow, I hope to be able to release a document that has phone numbers for local agencies that are willing to help people navigate. So right now, Senior Service Association, both in Aurora and Elgin, has been helping people and has been successful in getting people into clinics. But we also have a whole list of other organizations that we're just finalizing. As of 5 o'clock today, I'll be closing a survey of those folks. So that includes libraries and townships and other. What we want to focus on is trusted organizations that seniors can feel comfortable calling, because they may be providing some information about themselves, no financial information, but they'll be giving names and things like that if they're having someone who's volunteering to help them register online and navigate this whole process. So tomorrow, I hope to have that document out to everybody. But in the interim, like Carol said, Senior Service Association has been fantastic at helping people. As is the case for all of these things, whether it's the health department or Senior Service Association or the hospitals, everybody is being overwhelmed by the call volume. And you know, I frequently hear people say that it's frustrating to hear, you know, don't call us, don't call you, that's the message a lot of healthcare providers are putting out. But I think it is something we all need to be aware of is if you can imagine the 150,000 people who are currently prioritized, if they're all calling us and saying, how do we get the vaccine when we don't have the vaccine, it's been a major strain on all of our systems. So we want to be able to serve people and we want to give them information, but since there's not vaccine available in most cases, we're weary of sending too many people to call different places. I can say one more thing we're doing for the senior population. We're going to start when we host clinics, setting aside a certain amount of slots that will be specifically for the seniors that have been identified as not being the tech savvy people. So they're already on lists that we've been collecting. And then additionally, we're working with home health organizations so that eventually we'll be able to go, if seniors are homebound, we'll be able to actually get vaccine to them. And then we're also working with our providers on transportation issues. So ideally, we come to a senior facility and we can serve people as close to home as possible, or we can work with the townships and other groups to actually provide transportation to get people where they need to go for the vaccine.
Thank you very much. Their phone number for senior services, if anyone is interested, is 847-741-0404. Kelly has a question. In our conversations with Sherman to attempt to partner for our 1,000 employees, essential employees vaccinated, they've indicated that they are being told that they may not receive allocations to partner with them for vaccines for our employees. Is Sherman going to be a viable option in the coming weeks?
Yeah, I think that's a case where Sherman is stuck in the same situation as us, where they have the capacity. But actually, a county board member at a meeting this morning said it, we got plenty of cars, but no gasoline. I think we have the people who can give the shots, including Sherman, but they probably are just being conservative because they don't want to commit to something until they have a better idea of how much vaccine they'll actually have. I do have a number for Aurora Senior Services too, Carol, is 630-897-4035. So at both ends of the county, they can assist people.
Thanks, Michael. Appreciate it. Essential manufacturing business in Batavia, and most employees want to be vaccinated. So it's the same information basically that you've shared before. Another question, does the 1,500 new doses each week include the chain pharmacies? If not, how do those numbers compare? So what's the best bet to get vaccinated?
Yeah, and that's where it's a little bit complicated. So if it's a pharmacy that we're providing vaccine to, it would be included in that. But for these pharmacies that are getting it directly from the state or the Fed, that's not included in the 1,500 number. And thus far, we have not been able to get a report from the state or from the federal government to see which pharmacies are getting how much vaccine. So, but that is something we're working on.
So would you anticipate that the communication between organizations would get better in a week or two's period of time if the state doesn't know what the county health departments are doing and the pharmacies are doing? It just seems like there's such a disconnect in our state.
Yeah, and I think it's hopefully communication increases from the federal level to the state level. And based on a conversation we had today, the state said they expect that. And then hopefully the state is more transparent with us in terms of who they're providing vaccine to at the pharmacy level. And they have told us that they will do that. So that's another area where I'm more conservatively optimistic that communication is going to increase over the next couple of weeks.
Okay, thank you. Shirley has said she has spoken with Walgreens next to her office in Batavia. They said they're not doing any vaccinations at their location again until March. Is this happening throughout the area? That message, she said, should be communicated if that might be the case.
Yeah, I have not particularly heard that, but that's a struggle for us because each provider, and not just limited to pharmacies, is an independent organization. So we try to keep track of what everybody is doing, but it can change quickly. And just like this week, as we've seen more direct shipments coming from the Fed and the state. So we try to put the information out there about how people can communicate. But we do not have a real-time snapshot of what every provider is doing at any given time, which I realize complicates things, but we just, that's not something that exists.
Thank you. Is Kane County looking for locations to distribute vaccines in the coming weeks? If so, there are some companies that are willing to offer their locations as vaccine sites. Is that something that's of interest to you?
We're always looking for sites. We have a pretty good list of places that we've toured and planned out already. But I certainly wouldn't turn it away if people had places that they'd like to put forward. We're happy to have those discussions. But that's something we hear about frequently is people would say we should have more sites in the community. We have plenty of sites lined up, but we just don't have the vaccine to be providing at those sites. But if somebody wanted to pass something on to us, we'd gladly have that conversation.
All right. And if anyone wanted to get a hold of you, Michael, what's the best way for them to get a hold of you?
Yeah, I'm hopefully slowly getting smarter as we work through this. I'm spending about 4 hours on the phone every night because so many people have my phone number that I'm responding to. So I'm a little more hesitant in terms of that. But I will put my number in the chat. But just again, realize that every business that wants to call us that says they're essential, and this does not take away from anybody being essential or important, but we can't respond to everyone because there's just simply too many. So there's my phone number. That's a way to get a hold of me. But I'm being inundated. Just
I imagine you are. A question about what would you recommend is the best message to tell our business leaders about the vaccine and anticipation of getting access to the vaccine to our employees?
Again, I don't want anyone to wait. So if you have employees who may have reason that they would want to get the vaccine sooner, if they can get it through their doctor based on age, I encourage people to do that. Or if they can get it through their pharmacy, that's fantastic. I think there is going to continue to be opportunities for us to work together to look at more specific on-site vaccine clinics. Also, I think there's going to be more opportunities for you to work directly with CVS and OSCO that would not be brokered by the health department, but would be something that you would do independently. I think that those opportunities are going to increase. And I think it's going to be time. So it's going to take us a while once the vaccine starts to slowly come in more and more, where those opportunities are going to become more available. So I know it's a dirty word to tell people to be patient, but I think we have over 100,000 people in the current priority group, and we got 1,500 shots this week. It's going to take us a while to work through everybody, so patience is the name of the game. But we will get the vaccine to everyone over the next couple of months.
Michael, you talked earlier about the Johnson & Johnson product being available, we think, relatively soon. How long do you think, or what do you know from your professional conversations about that infiltration into the supply chain and how quick that will be?
Yeah, so there's still some information that we don't know in terms of who that will be recommended to be administered to in the community. So as the, knock on wood, we get the emergency use authorization, we could get clear guidance on who that vaccine would best be utilized with. And then we look at manufacturing and production, how soon they can get it to us. The state is getting 3-month projections from the federal government. They're trying now to start giving us a 3-week projection. I haven't seen anything, and that's why I don't include it in my presentation yet, that really I'm confident in. But as of our meeting with the state today, they said they're not including the Johnson & Johnson in our next 3-week projection for the state, but they hope that will change. So simple answer to your question, Carol, hopefully in the next couple of weeks, we'll be administering Johnson & Johnson vaccine, hopefully.
Terrific. If there's any other question, please do put that in the chat box as we begin to wrap up. Again, I want to thank my colleagues, including the Chambers of Commerce from Geneva, St. Charles, Huntley, Bartlett, Batavia, who I neglected to cite earlier, Hampshire, Algonquin, Lake in the Hills, Cary Grove, Northern Kane County. This is an exceptional opportunity to deliver up-to-date information on behalf of the Kane County Health Department through Michael's expertise. And so we are really appreciative of your opportunity to come with us again this week. We hope that we can set up yet another one of these meetings in a few more weeks and get another update from Michael. We are going to end with a final question I have, that is there any local information about the number of deaths associated with a vaccine or COVID post-vaccine?
Not that I have seen. No, I've not seen any reports of death due to vaccine.
Excellent. Well, thank you to everyone for joining us. Michael, thank you for your expertise and sharing and your willingness to be available. People recognize that you are, as you said, inundated with telephone calls. If your local Chamber of Commerce can help, please work with us, and we'd be glad to work with Michael and the Kane County Health Department. Thanks to each of you for taking time out of your very busy calendars. We do appreciate it. Stay well, and we hope to see you again in just a few weeks. Michael Isaacson, thank you very much for your time.
Great. Thank you, everyone.